Welcome back to Western New York Living. Now, as some of you may know, October is Breast Cancer Awareness Month. Unfortunately, breast cancer isn't the only type of cancer that is mostly specific to women. This morning, we're happy to have with us a doctor whose focus centers around gynecologic oncology. And it's a pleasure now to welcome in Dr. Stacey Akers from Great Lakes Cancer Care Collaborative to join us now. Doctor, thanks for being with us.
Oh, thank you so much for having me.
Now,
I really appreciate it.
Yeah, some of our viewers may not be familiar with the focus of a gynecologic cancer surgeon. Can you explain a little bit about your specialty and the most common female-specific cancers that you treat?
So GYN oncology or gynecologic oncology is focusing on female cancers of the female reproductive tract. That includes ovarian cancer, uterine or endometrial cancer, vulvar cancer, vaginal cancer, and cervical cancer.
And as
the most common.
Oh, I'm sorry. Go ahead. Please continue.
No, go ahead. So the most common type of GYN malignancy that we treat is uterine or endometrial cancer.
All right. Yeah, that's important. Thanks for getting that last part in. Some folks may not be familiar with the team at Great Lakes Cancer Care Collaborative. Tell us what makes your team so unique.
So at Great Lakes Cancer Care Collaborative, we have a community group of physicians and providers that offer comprehensive cancer care to patients, such as radiation therapy, pelvic floor reconstruction, pelvic physical therapy, sexual health, which is really important for females that have gone through GYN cancer treatment, nutrition programs, patient navigation, and try to make sure that we're treating the entire patient.
And I understand there's been recent advancements and improvements in surgical procedures for these type of cancers, perhaps reconstruction too, as you mentioned. Can you talk about the advancements and how it's benefited the patients?
So the biggest thing is the improvement and advancements in minimally invasive surgery. So 10 years ago, patients might come in for surgery for endometrial cancer or uterine cancer and spend 3 to 7 days in the hospital recovering. And now patients will come in, have surgery, and even go home the same day. So we went from maybe a week-long hospital stay to actually having patients go home the same day. Patients we know recover much better at home, not in a hospital setting. And that's been great. Also, the use of Sentinel lymph nodes and uterine cancer, vulvar cancer, and cervical cancer, meaning patients has been much previously studied and seen in breast cancer, but we know if we can isolate the sentinel lymph nodes and dissect those instead of doing a full lymph node dissection, these patients have less complications. Some of the newer treatments besides surgery is the use of immunotherapy to treat these GYN malignancies as well.
And I mentioned October being Breast Cancer Awareness Month, and women, I think, are very familiar with the annual mammogram. What sort of screening should women do, and how often should they do screenings for gynecological cancers?
So patients should go to their gynecologist on an annual basis. It's important that if a patient is healthy enough and well enough to have treatment, they should go to their GYN. The Pap test screening, it's really dependent. There are a lot of different factors. It could be every 3 years, every 5 years based on additional testing. But independent of that, there are other things that can be detected that may, when you looking at vaginal cancers or vulvar cancers or even, vulvar disorders, screening for cervical cancer. So just because you went last year or you went 2 years ago doesn't mean you should skip this year. It's really important that patients continue to have annual surveillance.
Yeah, certainly, and preventative measures can be discussed too at those annual visits. Doctor, thanks so much for the important information today. We're going to tell everybody how they can find out more about Great Lakes Cancer Care Collaborative and all the cancer services they offer. Head to their website at greatlakescancercare.org. Also on their website, you can request an appointment with Dr. Akers and all the doctors that comprise the group. If you have cancer-related questions, you can contact Dr. Akers' office at 884-3000 to speak to their helpful staff. Now, coming up next, Visually Impaired Advancement, or VIA, will be stopping by our studios to discuss some of the services they offer people dealing with loss of vision. One of the services we will focus on is their low vision clinic when we continue.
This segment of Western New York Living was sponsored by the following: